Okay.
Local health officials are concerned about the highly transmissible variant called Delta and how it is spreading, especially here in our community. As the CDC data is showing, much of the Panhandle is an area of high COVID-19 transmission, and vaccination rates, they remain low. KMR Local 4's Kaylee Green has more.
Delta transmissibility is quite severe. It appears to produce more severe symptoms. It can be more lethal.
Dr. Rodney Young, the Regional Chair of Family and Community Medicine at the Texas Tech University Health Sciences Center, says as the Delta variant changes and flourishes, it's a dangerous situation for everyone.
So that's why we're seeing rising caseloads, rising infection numbers, rising hospitalizations, and in the very near future, we will be seeing the rising numbers of deaths associated with this.
And it's especially concerning with our low vaccination rate. He says measurements of viral loads show that Delta is more transmissible.
They can see that it rises to high levels, and even high levels in people that were vaccinated and don't know they're infected. So that's what's raising this concern about the transmissibility and how asymptomatic transmission can be especially concerning.
Chief Medical Officer at Northwest Texas Hospital, Dr. Brian Weiss, says they had one person showing the Delta variant back on March 31st. Then nothing until they got 2 Delta cases in the 3rd week of June.
And since then, well over 70% of the cases at Northwest have been due to the Delta variant. So this really seems to be the major threat. Now, we do know that people can get the Delta variant despite the vaccines, but there still is a protective effect to these vaccines.
Both doctors agree vaccinations need to increase locally.
The vaccine is still our #1 tool for defense against COVID, whether it's original COVID infection, Delta, or the other variants.
I do recommend, please, consider getting the vaccine. That's our best way of trying to stop this virus, stop these variants.
Dr. Young says being vaccinated does not give anyone a permission slip to avoid public health practices.
We need to be more thoughtful about the mask, the distance, even for the vaccinated, as the prevalence of Delta rises within our community and nationwide, the risk of transmission is going to go up. So if that goes up, I don't expect that we have seen the peak of what we're going to see in terms of a rise in hospitalization rates.
Dr. Young also says vaccinated people are still at risk of developing an infection, but less of a risk of severe illness and death. Live in studio, Kaylee Green, KMR Local 4 News. Andy.
Kaylee, thank you. The CDC now says even vaccinated people should wear masks in crowded places, but there is no mandate.